everybody. Hope you are enjoying a little bit of the rain today. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. We're going to cover tennis elbow so you can figure out how to treat it at home. As always, if you have any sort of videos you'd like to see, anything, go ahead and post those in the comment section. But tonight we're going to be discussing things you can do at home to treat tennis elbow. So one of the first things that we always talk about, especially in our videos, is making sure that we're just not treating the pain. We don't want to just treat the pain. And this is where a lot of tennis elbow, golfer's elbow treatments fail, is because many times you just treat the pain. You want to resolve that inflammation, makes sense, but you don't actually resolve the problem. And in resolving the problem, you're going to be able to have it not come back. So it's really important that you just don't get a strap and put that on and call that a day, because that's not resolving anything. That's not treating the problem. That's just treating the pain. And unfortunately, it's going to get worse if you don't treat the problem, and it's going to possibly affect more areas than just the elbow. So really important that you treat the entire area. Also, a lot of times people, when they're doing this at home or when they're Googling it, it can be misdiagnosed. So it's important that you consult a medical professional in order to have it diagnosed. We offer free consultations. All you have to do is call our office at 215-997-9898. We'd be happy to get you in. But it's really important that you consult someone that can properly diagnose it. Is it coming from your elbow? Is it coming from your neck? Could it be coming from your wrist? So you have to really look at a lot of different areas when you're talking about where this is coming from, because it can be coming from a number of different areas. And that's where the hang-up sometimes is, and that's where it can really be an issue, because if you don't address the problem, you just treat the pain, you'll be fine for a little bit, but then it'll come back with a vengeance. So just be aware of that. So tennis elbow is pain on the outside of your elbow. There's a little ball right there that is really painful and can be really painful. So it's one of these point tenderness spots where you can absolutely put your finger on the spot and say, ow, that hurts. Ow, that doesn't feel good. So right around here, there's one on the inside of your elbow, a little bit point right in there. That's not tennis elbow, that's golfer's elbow. And then there's one on the outside of your elbow, and that's where you can really feel that pain. You're going to have some point tenderness. If you have a lot of pain in through here, not really tennis elbow, could be, but really a specific symptom of tennis elbow is this point tenderness, this pain that happens right here on the ball of that joint right there. So be aware that if that symptom's not there, you might be dealing with something else. Even if that symptom is there, you might be dealing with something else. So what do we do for tennis elbow? So first thing you want to do is you want to do just a couple stretches. So, you know, I always say you're going to stretch both directions. So you're going to start with your hand like this. Pull your fingers back towards your wrist. You're going to feel a good stretch in through there. You want to hold that 30 seconds, and you want to do 6 of those. And then you're going to turn your palm down and do the same thing. Just stretch like this, 30-second hold. And you want to do 6 of those. Really important to do both of them, to stretch out that entire elbow, 30-second hold, 6 times. Again, you can do this a couple times throughout the day. Since it stretches, you're able to do that. Then what you want to do is you want to do some strengthening exercises. So you don't want to strengthen the elbow. You really want to strengthen the shoulder. You want to strengthen some of that rotator cuff. So what you can start by doing is just taking your hand and resisting this motion, okay? So you can lay on your side and you can do motions like this, or you can take your hand and push against it and try and move it outward, but this arm can stop. That really depends on how sore your elbow is. If you can lay on your side and just do some rotations upward, that's going to help strengthen that shoulder and take some of the pressure off of that elbow. But if you can't and you're just really painful, you can start by either just putting your hand up against the wall and trying to press out, or pressing out into your hand like this. You want to hold that 5 seconds, and you want to do about 15 of those. And you're getting a lot of inflammation, you want to go ahead and stop that, all right? And then the final thing you want to do is you want to ice. Lots and lots of ice. You can put it directly on that area that's sore. You can ice, you know, I usually recommend maybe filling up a cup cup of ice or a cup of water, put it in the freezer, and then once that's done, just kind of ripping off the cup and then putting it right on that point, just rubbing it around so you can get some really specific ice treatment. No more than about 15 minutes, but you really want to make sure you hit that really, really well. We have taping techniques on our YouTube channel, Total Performance Physical Therapy. You can go there and check that out if you would like. That also can help that area. But again, it's really important that you consult a medical professional because you need to address all of the reasons that this is occurring, and you need to make sure that you are strengthening everything correctly and stretching everything correctly. If you or someone you know is suffering from tennis elbow and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.